Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning, everyone, and welcome to the Senior Moment Show. My name is Bryce Patton, here with Sid Roda, my co-host. How are you today, Sid?
I am doing awesome. How about you, Bryce?
I'm wonderful. I had a nice little drink to give me a kick in the pants this morning to wake me up, actually from our guest that we have today, and so I'm pretty happy and chipper as well. So things are going
You
well.
might have to tell me more about that drink you had there.
I'll tell you off the air. Just kidding.
Okay.
It's actually wonderful. And we'll get into that actually with our guest today.
Okay.
This stuff's wonderful. Before we dive into our guest, would you mind telling us about our sponsor today, though?
Absolutely. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and effort to provide information to seniors, their family members, and really anyone that likes to listen to us. We do so via this radio show. And actually, our guest today is a new member of the Empowering Seniors Group, and we are so excited. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info. You can email us at empoweringseniorcv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for this show, if you missed anything, you can call me personally at 435-512-6406.
Oh, thanks for doing that. I'm just glad you do that. I don't have to. All right. Well, I want to welcome our guest. We have Oliver Hoops with us today. Me and Oliver go way back,
yes,
but for our listeners, do you want to kind of introduce yourself,
Yes.
what you do, why you do it?
So I'm Oliver. I've been in the Valley for about 20 years. I love this place. We, for about last decade though, about 2010 till 2020, I had a bunch of pharmacies. I owned a bunch of pharmacies, and that's where I actually met Bryce. We had pharmacies in Utah, Idaho, Montana, Wyoming. We had them everywhere. And then back in about 2020, I had a cousin that came to me, real smart guy, and said, "Hey, we should start a supplement company." And I said, "That's a terrible idea." And he said, "Why?" I said, I told him everything I hated about supplements because they were too expensive or they didn't work and all this kind of stuff. And he said, "Well, let's just do it differently." So we started that back in 2020. I got out of all my pharmacies, and then we fast forward to now, and we just got back into pharmacy again at Cache Valley Pharmacy, and it's been fantastic. It's supplements go hand in hand with the pharmacy world. It was kind of weird thinking that, you're only allowed to take care of sick people at the pharmacy. And we're like, well, you should be able to take care of the healthy too. So we got pre-workouts, we got protein, we got everything, but we also have some of the highest end supplements you can get. They did a test on a bunch of Amazon supplements, and they pulled 20 of them. 17 out of 20 came back at less than 3% of what they said was inside of them. So we send ours out for third-party testing, and ours come back between 98 and 103% accurate. So ours are absolutely perfect, accurate. It's actually crazy because there's no regulation on supplements out there. I could fill it full of sawdust, and there's nothing you can do about it. They don't do anything. And so all of ours are very high-end, very high quality, but we also kept the cost at very reasonable cost because we hated that. The really good supplements cost a fortune, and I'll compare mine to anybody's in the nation. We got some really good stuff. So it's been fun, but getting back into the pharmacy world's been a lot of fun.
So going off to this, I have one of their drink supplements, Hydrate, and it's the Pina Colada, and it's fantastic. Like I said earlier, helped give me a little kick in the pants to wake me up this morning, and it's really good. And it's called Focus Pharmacology. You might have heard it on the radio, other places. They sponsored the lights this Christmas, and it's a pretty awesome deal.
Yep, we love Christmas lights.
So why in the world did you, if your supplements are going so well, why did you want to jump back into the pharmacy side of things?
So it was a good opportunity, but I love pharmacy, and I think there's a lot more opportunity in pharmacy than what's out there, what they're doing right now. 84% of Americans take supplements. There's supplements everywhere out there, but they're getting them from all these garbage places, and somebody's taking a vitamin D and never raising their levels, and I'm like, this, everybody in this pharmacy is already getting vitamin depletion with all their medications they're on and things. And the thing with the medication side of things, a lot of times you take a medication and it just masks the problem. You take something just to get you to sleep, but it doesn't fix why you can't sleep. You take some magnesium, something like that, it's actually going to help you get to sleep and keep you asleep. So the goal is to get people off their medications. It's funny getting into pharmacy to get you off of your drugs, but that's the whole game plan of it, because your body can do it by itself. It just sometimes needs a little help.
It's amazing, Oliver. I just met you. I'm intrigued, I have to say, especially because I've just turned my life around with a very restricted, health-oriented diet and working with a functional nutritionist. So I'm definitely going to have to visit your pharmacy now and look at some of your supplements. It's amazing. Yeah. My brain is so busy right now that I can't even think of a question, Bryce.
No, I love it. So I come from pharmacy. I mean, you're the one that introduced me to the pharmacy world and whatnot. And it was always very surprising how the pharmacist, that was kind of everyone's goal, was to actually get people off their medications and different things. And I thought it was kind of backwards, because that's their livelihood, but they really care about people and their whole health of things that go on. And it's amazing because there are certain things that are, you take an antibiotic, which helps out, right?
Yep.
But you need a probiotic with it to counteract the effects. And essentially that seems like what you're hoping to accomplish with the pharmacy side of things is you get to help people holistically.
Correct. And that's, as the year goes on, we got a lot of new things that we're going to bring in. We're going to start doing vitamin depletion, lab draws right in the pharmacy. We're actually working with a telehealth company right now so that you can actually walk into the pharmacy, get a prescription while you're sitting in the waiting room of the pharmacy, and then get your medication right then and there. You can even do it from your own home, but these are a lot of things that we're going to implement throughout the year and stuff. But it's shocking how depleted people are. We've done hormones a lot for many, many years, and that was the other thing. We've sent a lot of practitioners to teach them how to do hormones, and then they come back to the pharmacy and they'll do the compound, and we do a ton of compounds there, but we're trying to figure out how to implement that into the pharmacy as well.
You mentioned a word that some of our listeners might not understand what it is, but what's a compound? So
that's a custom-made formula out there. So, a lot of hormones get compounded formulas, with testosterone or estrogens, progesterones, things like that people are using for hormones. But then we get into, everything that's customized out there. We can make it in-house. We're actually, within the next month or two here, we'll actually be doing sterile compounds as well. And that's a very rare thing in a pharmacy because it's a lot of cost, and it's very, very accurate. You have to be very, very good at this. And so we wanted to make sure we are the best and bringing in the best pharmacists and staff, but we'll be able to do sterile compounds too, which I don't know what ones we're allowed to say on the air, but
give us some examples.
So some of the GLP-1s, a lot of the weight loss stuff out there right now. Okay. So the cost is incredibly different. You're paying thousands of dollars for some of these things, and when you can get it sterilely made in a compounding pharmacy, you're a tenth the price. And so it's fantastic for the community, great for your health, and again, it's a package deal. Yes, we want you to lose weight, but we want you to keep it off too. So that's where these supplement depletions and things come into play, where it'll help you a lot in your long-term goals.
Great. Thank you, Oliver. We're coming up on our first break here already, so we have just enough time to mention your contact information.
So you can just see us at cachevalleypharmacy.com or come into the pharmacy. We're up in North Logan. It used to be in the specialty hospital. Now it's just a block south of that and in the 3-story little medical plaza there in the bottom. But we got the drive-through there. We got everything. But yeah, just cachevalleypharmacy.com. Okay.
Thank you, Oliver. This is the Senior Moment Show. We're at our first break. We hope you stay tuned because we'll be right back.
Are you tired of feeling unwell and not knowing why? At Next Level Health and Wellness, we hear you. We specialize in uncovering the root causes of your discomfort, whether it's gut health, hormone imbalances, or emotional and mental blocks. With personalized plans, advanced lab testing, and evidence-based holistic nutrition practices, we guide you toward lasting health and wholeness. Awaken your healing potential with a team that listens, understands, and supports you wherever you are. Visit nextlevelhw.com to start your journey to feeling better today.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most.
It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
And welcome back to the Senior Moment Show. My name is Bryce Patton with my co-host Sid Roeder, and we've been getting all sorts of awesome information from Oliver Hoops over at Cache Valley Pharmacy and Focus Pharmacology, his supplement line. And you've been talking about the holistic view of helping your patients over at Cache Valley Pharmacy. In the break, you were telling me about some of the other programs that you guys have to help out, especially our seniors.
Correct.
Right?
Yep.
What are some of those, and you want to kind of dive into what you have to offer?
So that was another thing when it came to pharmacy. There's actually a lot of programs out there that pharmacies can do. It just takes a little time and organization for them, but they are fantastic for seniors, and a lot of seniors qualify for them for free. But one of them being sync. Sync is synchronization. So you get, the average person at 45, I think, is at 4 medications. The average person over 65 is between 9 and 13 medications a month. So you're going to the pharmacy a lot. And so this sync program actually syncs it up. So it's one time a month. They set it up so, it's the first Wednesday of every month, and 28-day cycles and things like that. So you're not running out on a Wednesday. You're running out you're not running out on a Sunday. You're running out in the Wednesday. So you're not rushing over the weekend to try to get it figured out. The other things with them is that they sync that up, but then they also have the free delivery and free packaging on that too. So they can package your meds so that it's all separated, so that, whether it's you or whether you're getting it ready for mom and dad, you don't have to do that anymore. It's in one big package, and then it gets delivered to your doorstep, every 28 days. And so they'll call you ahead of time and say, hey, anything changed, anything new, anything different, and if you get a med change in the middle of it, they can sync it up and fill it for, 12 days. And then your next cycle.
Make it work.
Yep, you're all set up, so you're not going to the pharmacy all the time.
So when you say one big package, what does that package look like? Because now I'm thinking I've got 12 meds in a big package, and I'm not sure what to do with them. So what does this entail? So that package is actually it's a little blister pack of it that can fit in your pocket. So all of them get put in there. Some meds are bigger. Omegas by omega-3s are a bigger capsule, so sometimes those get packaged separately, but for the most part, it's just a little package that literally can just fit in your pocket, and it peels off. You can rip it off and put it in your purse or whatever. So this is your daily dose of your medications. They'll separate them from morning till night, whenever your dose is due, and they'll put it in that. So you may get 3 or 4 of those because you have a morning dose and a night dose, and you may have the extra supplements you use on the side. So, but it's still separated, so you don't have 13 different pill bottles. So this is basically replacing your little plastic weekly organizer that you have to sit down with all your meds in front of you and fill those individually. So that's essentially what that's replacing then? Yeah, and the errors that get caused from that too is crazy, because it's, we've looked at a lot of people's meds and we're looking at their monthly doses or that weekly, thing. And they're totally off, because they're having somebody come in that's helping them do that. And most of the time it's a kid that's coming in and they're getting it through there, and they're thinking that they're doing it, but they don't realize that Wednesday is actually a skip dose, or they're only doing it on the morning this day, but not this night. And so dosing gets really weird out there. And so letting us deal with that is a great thing, because the tech will do it and the pharmacist checks it, and we make sure it is perfect.
I can't help but hearing that you're dissecting someone's medication and needs, that if someone was considering to switch pharmacy, do they need to bring some time to chat with you to figure out what the best route is, or to even, as you said, to see if there could be a change in medication?
Yep. We actually have a dedicated tech. We have a couple techs that specifically just do this program. So you have your own personal concierge pretty much. It's nice to come in and go through them, and we look through it and check it, but we'll go through all the doctors and send the doctor so we get all their orders. Because we've seen that a lot too, where we always get a piece of paper that comes in and they said, here's my dosing and here's the times. And then we get the medication and we get the prescription, and it's not even close to that. Like, they may get told one thing. So that's, again, trying to figure out the communication between the patient and the doctor and hey, when do you want this dose being done? So there's so much to it.
So with that, though, like, how does someone, if they want to, let's say they're going to one of these commercial pharmacies and they just aren't happy with it and they want to transfer over to a local pharmacy, what are the steps that it takes to do that?
So easy. We actually break up for you. And it's, sometimes there's some wonderful pharmacists out there. I love a lot of these guys in town. But sometimes their store doesn't offer what we offer. And so we're actually able to, the pharmacist actually calls the pharmacist over there, and we transfer all your medications for you. So this is nothing, you don't have to do it. You're not calling all your doctors. We actually call them and get all the information, get all the stuff, and get all the transfers for you, including refills, including everything. And so you literally do nothing. We'll do everything for you.
And before the radio show, we were talking a little bit about, or you mentioned it in the last segment, about maybe reaching a point where doing some blood testing for maybe some lack of vitamins and things like that. Is that, how far out is that?
We're still a few months out on that. We're trying to get everything organized and get some, like I said, we got a lot of programs we want to do, and that definitely will be rolled out this year. We're probably still 6 months away from being able to do labs and things in the pharmacy, but we're going to have the capability of doing that, and it'll be great. So, and
you'll have that in the home. You'll be able to do telemedicine in the home as well. Is that
yep. We have the telehealth that we're working with that we'll have a screen set up at the pharmacy itself. So if you're not, feeling good, you can come in. And sometimes these doctor visits you can't get into your doctor for weeks sometimes, and sometimes it's hours. We'll be able to do it immediately right then and there. And then we'll be able to also have a program where, whether it's from your phone or from the website, where you can actually visit the telehealth doc through the pharmacy's app or through the pharmacy, get the prescription and everything from your own home and have that delivered. So you don't feel good, you don't want to go in and get it done.
Fabulous.
So, and we're only a few months away on that too.
So how about, I know for a minute, some pharmacies in the Valley were offering strep testing, and then that went away again. Is that something that you offer, or does that go through the teledoc?
Nope. So strep testing, there's a handful of tests, strep testing, COVID testing. There's a few other flu testing and stuff like that. They'll all be done through the pharmacy, and we're only a couple weeks from that. So again, we just barely took over on January 1, and so there's a lot of paperwork that we have to do to transition, and the state has a lot of rules and regulations that we need to cross every T and dot every I. So once we get that here in the next 2 weeks, we'll be done with all those things, and then we're going to be able to roll out all of this kind of stuff. But yes, all that strep testing will be able to be done in the pharmacy within the next couple of weeks.
That's perfect, because that saves a lot of time. Sadly, we're already coming up on our second break, Oliver, so I want to give you another chance to mention your location and maybe also your phone number if someone has any questions.
Yep, perfect. We're just Cache Valley Pharmacy. We're up on 2200 North and about 4th East there, right on the corner. Our phone number is 435-787-1212. Pretty easy, 787-1212.
Thank you. Let me briefly mention our sponsor again, which is the Empowering Seniors Group. If you'd like to learn more about them, you can do so online at empoweringseniors.info. We're going to take a short break. Stay tuned. We'll be right back.
Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks. These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty.
I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
And welcome back to the Senior Moments Show. My name is Bryce Patton here with Sid Roeder, and we've been talking with Oliver Hoops over at Cache Valley Pharmacy, talking about all the different programs and things that you guys have going on, the exciting new changes and fun things you guys are going to implement for the community coming up this year. I was curious in the break we were talking, and you'd mentioned earlier about delivering meds to the home or mailing. Is there a cost with that? And is there a radius that you will deliver within?
Perfect. Great question. So we don't, it's a free delivery, whether you're a senior or not, we'll be able to do that. We want to get you synced up though and get all those meds at the same time. We'd like to deliver 1 time a month versus 13 times. And you would too. Mm-hmm. But we offer that to everybody, whether you're 25, 45, 65, we'll do it for everybody. And it's the entire valley. So if we get into Preston and over the mountain and stuff, we will mail those. We can even mail them too. A lot of people are like, I don't even want a delivery, just mail them to me. So we have no problem with that. It's easy and throw it in the mail and it's there the next day anyways. So it works out really well.
That's awesome.
I can tell your mindset is really on helping people and making things maybe a little bit easier and omitting errors in dosage and things like that. So I'm just kind of curious, what usually keeps people doing what they're doing is some fun stories that they can remember. Do you have any stories you can share?
Yeah, we have so much success stories with our supplements. Like I said, when I first got into supplements, I thought it was a terrible idea because nothing worked. They were always just garbage stuff. And so it was one of our main focuses when we first got into it was sleep. Sleep is such a big thing. People have such a hard time sleeping. And the other thing is your body resets when it sleeps. So when you're taking a medication to go to sleep, you're not really falling asleep. You're just kind of shutting your head off and it's not really shutting everything down. So we started getting into vitamin depletion and the amount of people that are low on magnesium is crazy. You just get a magnesium. We have a relax supplement. We actually made it for ADHD. It was made for during the day and stuff, but then the side effects of it was you had a fantastic night's sleep. It has magnesium and GABA, L-theanine, has some of these key elements to help you to put you to sleep, keep you asleep as well. But we have numerous different ways to keep you asleep. And, we'll get into our other, some people just take a melatonin and they just want to go to sleep. We have melatonin in our sleep capsule, but it also has magnesium in it. And it also has things GABA in it and things like that really help not just put you to sleep, but keep you to sleep. Because I have people that, get up at 2 a.m. They fell asleep great. They fall asleep easily, but they wake up at 2. And then I got people that have a hard time falling asleep, but once they get to sleep, they feel good. This is the all-around thing. Get into some other things. I've had people that we have a urinary one for UTIs that I could sell it door to door. It's the best UTI supplement I've ever had people come and tell me. We talk about multivitamins and stuff, and somebody says they take their multivitamin. The multivitamins are great, but that's the thing. There's just a bunch of a little bit in there. When you're targeting, I just need to go to sleep. Restless legs is another big thing with magnesium. That's wonderful for it. Probiotic is a wonderful use too if you're getting on antibiotics, and probiotic helps with acid reflux, things like that. We got a super immunity blend where I've had people not been sick for 2 or 3 years that have been on my immunity blend. Again, for me, it has to work. I have to see it to work. If I can't physically, see people get better, then I don't care. And yeah, that was that thing with the vitamin. A lot of times people would be like, well, it takes, 90 days for saturation. Now we want to get better sooner than that. So our stuff is really potent and has absorption. That's the other thing with ours is absorption. If it can't naturally absorb, we actually add things to it to help absorb. So, anemia, we have an anemia one for iron deficiency, but we put vitamin C in it. Anybody who's had iron deficiency usually takes it with orange juice because vitamin C helps with the absorption of iron. Ours, we put the vitamin C in it. So you can take it and the absorption works there. But we have numbers to track all of this stuff. The numbers are mostly from us, our personal use, saying, well, let's test it. Let's test our vitamin D now, and then we're going to test it again in 6 weeks. 90%, 95% of Americans are vitamin D deficient, which is the sunshine vitamin. I mean, especially getting into this time of year, everybody should be on a vitamin D. So, and it has to have K2 in it. It helps, again, with the absorption, with the transfer of calcium. But
okay, now, so you just gave us a ton to think about, but if somebody has questions and they're concerned, hey, what supplement should I actually take? How do they go about consulting with somebody?
So you can come into the pharmacy at any point. Where this was, again, part of this pharmacy thing where we are making vitamin experts in this supplement depletion experts in these pharmacies now. And my pharmacy has numerous people that can help with this, along with the pharmacist. And this is just, the tip of the iceberg. You come in with, I have this problem, we can give you that solution now. This will help with this. And then we don't even get into the side where the pharmacist can step in with the vitamin depletion of all of your medications you're taking. The amount of depletion you have with medications is unbelievable how much it hurts you. So you got to replenish that with something, or it's never gonna get better.
So is it standard practice that you make recommendations even when people just come in with their prescriptions?
So yeah, the pharmacist is there on a lot of these things, and they're over our shoulder all the time giving that. But we have vitamin experts that can just help you out on the floor there quickly. And I'm taking this. What's the difference between what I'm taking and you have? And so whether it's the pharmacist themselves or whether it's a tech being able to help with that, somebody will be there to help you at the pharmacy.
Thank you, Oliver. Sadly, we are at the end of our show. So if you missed the phone number, maybe you want to email us at empoweringseniorscv@gmail.com or visit Cache Valley Pharmacy. This is Sid and Bryce with the Senior Moments Show. We'll hope we have you listening again next week.